Couple more minutes. Welcome, everyone. Well, while we wait, Dr. Roistacher, did you happen to see the newsletter this morning?
I did.
There's some really good studies in there. I really liked the one that was about bone repair with EMTT.
Yes, I'll tell you, the EMTT is the one that I'm most excited about after seeing it in Atlanta a month or so ago.
Yep.
That is the next thing on my wish list.
It's my favorite for personal use because it's just like anti-inflammatory like that, which is great for people with inflammation problems.
And you can keep your clothes on. So
Yeah, I was gonna, it's a big factor, leaving the clothes on, being able to kind of set it and forget it, and the patient's feeling the results immediately.
Yep, for sure.
Excellent. Excellent.
Got a few more people coming in. Hello. We will begin in 4 minutes.
Sierra keeping us honest.
We're going to be on time.
Q&A or chat?
Either or. Two. Ready.
2 minutes.
Welcome, welcome. We will begin in 2 minutes. Hello, everyone. Welcome, welcome. We're about to begin. All right. You want to kick us off, Kui?
Okay, well, guten Morgen, everybody. My name is Gustav Kinos here with Kinos Medical Technologies, and I am here with my two friends, Sierra Flythe and Dr. Jeff Roistacher. And just before we begin, as we progress through the webinar, if you guys have any questions, please just put them down below in the Q&A or the chat, and we will answer those at the end of today's webinar. And then we will also have a special promotion for you guys for only the webinar attendees at the end as well after the Q&A. So please hang around until the end for that. And then, yeah, let's get started.
Awesome. Thanks, Gustav. Hi, I'm Sierra Fleith with Keenest Medical Technologies. I also want to welcome everyone to today's webinar. We're going to be looking at the transformative potential of shockwave therapy as an investment opportunity. And we're delighted to be joined by Dr. Roistacher, who's an esteemed expert in the field of shockwave therapy and implementation, as well as a multi-clinic owner. So welcome. It's a pleasure to have you today, Jeff.
Hi, welcome everybody. Looking forward to the webinar today and just sharing really my experience with Shockwave.
Fantastic. Well, to kick things off, we're going to delve straight into the heart of the matter. Shockwave therapy has been gaining a lot of traction as a promising solution for pain management across a lot of different medical disciplines. And I would love if you could enlighten our audience on the level of clinical evidence that supports this efficacy.
So I'll tell you, when I started my search for adding Shockwave to my practices, it was really mind-blowing because I do a lot of work with other modalities like class 4 laser that has 900 medical studies. And then when I looked into Shockwave, there are 9,000 plus. So whatever we want to say about it, there are more studies nationally and internationally than really any other treatment that I've utilized in my 25 years in practice. So it clearly stands on a huge mountain of science, peer-reviewed information, and really has been a game changer in my practices.
I love it. Well, for our viewers who might be unfamiliar with the mechanics of shockwave therapy, would you be able to provide a brief overview of kind of how it works?
Yeah, so even as I describe it to the patient base, what I'll say to the patients as they come in, and I'll say, you know, I have a different recommendation that I'm going to make today. So side note, been a chiropractor for 25 years, and bringing in modalities like this are really just game changers for the practice because the doctor gets excited, this team gets excited, the patients get excited. So I'll say I have a different recommendation for you today. We're going to look at shockwave treatment for your rotator cuff. Now, traditionally, you have other choices in care, none of them really too great: opiates, cortisone injections, and surgeries. So what I'm going to introduce to you is a therapy that has been around since 1980. It was initially utilized in hospitals to help break kidney stones. In 1990, it was brought into the US. In 96, it was the treatment of choice for the Atlanta Olympics. This therapy is one of the greatest healing treatments that I've seen. And the way that it'll work is we're going to go through 3 parts of your treatment today. We start off with a vibration device to prep the area, get the blood circulating and the cells moving. We move on to a radial part of the treatment. And think of that as getting into those big muscle fibers and those working the muscles and breaking up any of the adhesions or trigger points. And then we're going to do something called focused. And focused is going to go very deep, about 3 to 4 inches into your shoulder. It's going to create a level of healing not seen before. It's going to break up any adhesions or restrictions through the acoustic waves that are going into that joint. It will help to increase range of motion, decrease pain, and heal the area. The way that I verbalize it in my practices is we call it, the nickname of it being the stem cell machine, because of its ability to release the stem cells out of that area of the bone marrow and truly creating a next level healing.
I love it. Yes. So with what you're saying goes right into my next question perfectly. So when individuals are making those choices and considerations for what's going to help their practice and what's going to integrate best into the treatment plans they're already providing, what are some of those key considerations that you went through that they should think of as well?
So the way that my brain works is I'm 50% healer and 50% business brain. So anything that I bring into a practice, it has to feed both parts of my brain. When you have a treatment like this that stands on so much science, it's almost a no-brainer once you understand how it works. And not only can Shockwave be done by itself as a standalone treatment, I actually believe you could have a practice that is completely shockwave therapy because of the ability for all the conditions that it can treat. But outside of that, let's look at it from the business perspective as well. And this is something where if you think about a traditional adjustment or treatment in a chiropractic office, everyone has now been accustomed to think it is a copayment or it is a $29. So when you present a treatment that is non-insurance based that they haven't heard about before, but stands on a huge mound of research, you can see how it piques their interest. They want to hear a little bit more, and obviously they want to get into the time component of the treatments and the financials, which I review with the patients personally.
Ah, great points. So then, what do you think they should look for first when making the choice for the right shockwave device for their practice?
So let me answer that question with explaining how I did it the wrong way so that others can learn and do it the right way.
Perfect.
So I think everyone in my profession and probably most medical professions are getting inundated with Facebook ads and Instagram ads, with StemWave and SoftWave being the ones that I'm running into the most. So I initially thought of adding Shockwave to the practice. I saw StemWave everywhere, so I did a Zoom call with them. I actually went through the financing and got approved and ordered it. And then I did it backwards. So I don't recommend anybody else do it the way that I did. I actually went and ordered it first. And second is when I reached out to friends in the profession that were much more proficient than me. And quickly they turned my decision process away from StemWave. So I actually canceled that order even before it arrived. Because for me, I'm just going to admit it, on the Zoom call, I'm a little bit of an equipment snob. I literally want the best equipment in my practice because I feel like we're going to war each and every day with our patients, and we're taking care of very complicated conditions that in most cases will end up in surgery, yet we're able to provide something to them to keep them off the surgical table. So.
Definitely. So, just to elaborate on that question, so what would you recommend for someone trying to make the decision between radial and focused, as where they should look first?
I know that's the number one question that I receive from everybody. And here's my example. I feel like if you buy one without the other, I feel like it's buying this beautiful, beautiful car with no tires. They marry so beautifully together. They work so well together. And when you combine the two, I will put that up against any treatment on the planet. So as I view radial, I think of it as being more into, again, the deeper muscle groups, which are absolutely valid. But when you want to get in deep into the joint, focused is like nothing else. So the combination of both to me is like a full treatment. It would be like having decompression without having a computer connected to it. It would be like having electric muscle stim without having the electrodes to use it with. I couldn't even imagine doing one over the other when both of them are really my thoughts of what true shockwave is.
Completely right.
Oh, perfect. So, I mean, I think you already answered my next question here, but just to let the viewers know, what type of shockwave devices do you have in your clinic?
So after I went and purchased from StemWave and canceled the order, everybody kept steering me to Kinis Medical. So I made a call down there. I actually spoke to Mary Edna, and I spent about a 30 to 45 minute call with her. And I mean, she gave me a master's degree in this. She talked about the technology. So what I've come to learn is Storz Medical has 75% of the worldwide share of Shockwave. They are the industry leaders. And Kinnes Medical is the branch 25 years experience in Marietta, Georgia, where to me, what was important is to have the best equipment, but also the best training, troubleshooting. I can't tell you how many times we've reached out and said, oh, we got a complicated case. We're not sure what we're supposed to do with this or that. And the marketing component too. So one of the things with StemWave is I was told for a $5,500 upgrade that I would have access to their marketing. And let's be honest, we could have the greatest piece of equipment on earth, but we have to be able to market it as well. And then in speaking to several friends, they said that upgrade of marketing was really kind of smoke and mirrors. So working with Kinnes, their Sierra, who's their marketing guru, she's just helped us completely with that and really being able to outline it, present it on social media, as well as how we brand and market within the practice itself.
Perfect. Thank you for that answer. So, so with your focused and your radial device, what treatments do you offer, and like what type of conditions do you treat in your office?
So I'm going to tell you the problem first in my profession. We like to buy things, wheel it out once or twice a day for a patient that we think might need a treatment. And it's famous for ultrasound. It's famous even for electric muscle stimulation. As I was integrating it into the practice, I looked at the practice base, inactive patient base, and active patient base. As a chiropractor for 25 years, obviously the spine has been the main specialty of 20 of my 25 years. But as we started getting into things like TMJ, shoulder issues, obviously spinal issues, it's wonderful for hips, knees, amazing for SI joints. I can't tell you how many SI joints we're able to free up from there. You got to look at the Achilles tendonitis, plantar fasciitis. There's so many clinical applications that it's funny to me that it started off as a therapy to break up kidney stones, and whoever moved that machine around into the different body parts has created one of the best treatments that I've seen, bar none. I actually was down in the training in Atlanta, and after getting an advanced certification in it, my new tagline or my new philosophy is that I have a Lamborghini in my office, and I have been driving it like a Honda Civic. Since that advanced training, it has been lights out. So getting back to conditions or patients, every patient is a candidate. You just have to look through it in different eyes. It doesn't have to replace your adjustments by any means for chiropractors, but the way that it can be presented, the conditions that it can treat, simply expand your wheelhouse.
Well, chakra therapy is a great tool with so many different types of clinics, and precisely because it can be operated by any trained staff member, not just a licensed practitioner, and it can be used across so many different realms of whether it's pain management, rehab, different things. And this has all been very great information for us, Dr. Roistacher. So my next question is, can you share some of your best success stories or case studies from your practice?
I'm going to tell you, when I was just thinking about this, that for some reason, February turned out to be torn rotator cuff month. It's just funny in practice because you get one case, then two, then three, four, five, six, seven, eight, nine, 10. So they all came in there. Each of those 10 patients were told that rotator cuff surgery was necessary, was mandatory, was imminent. And each of the patients, I said, listen, we have the ability here to help you repair this joint non-surgically. Start off with initial evaluations, and obviously with shoulders, the range of motion, strength become huge issues. So as we run through our treatment plan with them, we went 10 for 10. Each of the patients had absolutely incredible results. Everybody canceled their surgeries, and everybody was able to get back to tennis and pickleball and working out, and even just the day-to-day stuff of doing laundry and doing dishes. There's so many conditions and so many different success stories that we've had that I actually phrase to the patients that our Shockwave has a 90% success rate and above for quite a number of conditions. The other thing that I do with it is, and what I call my secret sauce. We all think about a technique, a therapy, or a treatment by itself. But when I brought Shockwave into decompression, when I combined it with laser, when I brought it into our neuropathy program, when I brought it into our knee treatment program, I just feel like as we sit here in North Carolina that we are providing the best care in the state, bar none.
Perfect, perfect. Well, I'm sure your patients really appreciate that, and then that probably fills your heart pretty well as well. But so in your clinic, are you actually doing the treatments, or do you have staff that are doing the treatments for you?
So with almost every treatment, I bring it in and I like to do the first few weeks or month myself because I want to get proficient first. But what I quickly found is it can be entirely staff driven. And the way that I've designed my practices is to empower one of my CAs. So I have a director of Shockwave, I have a director of decompression, a director of laser, not just an assistant, but empower them, put them in charge of it, make it their baby. And all they want to do is accelerate with it, learn. My main director of Shockwave, she's just devouring the studies. She's learning so much more. She's reaching out on her own. So for those that like to do the care themselves, it's going to be one of the most enjoyable treatments that you perform personally. But I always feel like with the doctor, the ability to delegate it to other team members frees up the doctor to obviously see more patients, more consultations, and more of that. Everybody should have their place within the practice. And because these are small businesses, the doctor cannot do everything themselves. They can't answer the phone, do the treatments, consults, exams, report of findings. So the true success is to bring something in that can be delegated and really, again, a staff member being promoted, being made to feel that they are even a more valuable part of your team.
I love that answer. Well, thank you for highlighting those important points for us, Dr. Roistacher. We're actually going to open this up to questions now. Our first question comes from Derek Anderson, and he says, are there any key insights or learnings that you can share regarding your marketing strategies to build up awareness and drive demand and revenue? What's worked, what's not? Anything that you recommend for a practice making a new investment with Keenis? Thanks.
So it works a couple different ways. Let's talk internal marketing first, because when you bring something in, why not have your current patients that know you, that trust you, that love you to integrate first? So some of it basic marketing materials that I received from Keenis. The banner we actually have up and stands outside of our front door. The brochures around the office. I do a thing, what I consider the number one internal referral component. I do the Cairo TV network. So I have 8 flat screens around the office and they'll play music. They show the weather, but every 5 minutes it plays a video, a YouTube video. So I loaded several with Shockwave. And if you think about these 8 flat screen TVs, if you think about posters, brochures, everything is designed to simply stimulate a question. Doc, what is this shock thing that you have? The most important on top of that is each and every one of your team members in the practice, the person that's answering the phone, the person that's doing these therapies, they also need to be excited, but they need to be proficient in being able to give what I call the elevator speech. So you're on an elevator for 30 seconds and they go, hey, what do you do for a living? So Shockwave, you have to be able to give your little elevator speech, get an excitement from the patient, explain how it will work for them, but also you're always going to hear, but my wife has a knee issue. Do you think it could help? You know, I'm having a tennis elbow. Do you think it can help? So the stimulation of marketing it to your internal practice again, educating them quickly, because step 2, you're going to attack your inactive patient base. People that have been in your practice that maybe they're not there currently, but a little simple marketing, text marketing campaign, email marketing campaign. We have a new treatment that we're releasing March 1st. We'd like everybody to come in and see what it is. You can offer a little demo with it. So things in the beginning, it doesn't have to be a lot of money spent on marketing. I always feel like you farm your current active practice first, and that alone can feed you for a couple of months.
I completely agree.
Perfect. Well, then we have the next question here. You mentioned that you went from driving a Honda Civic before attending training and now a Lambo. What is it in the training that really made the difference?
So it was really the 2 pieces of it. One was the lecture portion. Michael is the medical director, and I found his teaching style to be very engaging. So let's call it the PowerPoint textbook aspect of it, to really learn the science behind it and how each piece of the treatment works. The other part that I loved about it, and maybe this is even my favorite, is there was a breakout into different labs. So I think there were 6 or 7 different groups, and there would be 5 to 6, 5 to 7 doctors per group with an instructor there. We'd be given a written case study. We had to look at the case study, and then we had to address how we would take care of it. And then we would actually perform the treatment under supervision. I don't believe Shockwave is one of those treatments that you plug it into the wall and you can just be proficient with it. It's something, there's an art behind it, how you have your hand placement, the angle of how you're going to do the treatment, the basic anatomy of where you should be. So those labs, to me, when I came back that Monday, we were just on fire. I felt like every patient we converted that next week, 100% were Shockwave. And I'm like, you get Shockwave, you get Shockwave, everybody gets Shockwave. We were the Oprah Winfrey of Shockwave, but they paid for it. We don't have Oprah's kind of money in my practice.
No, that is absolutely perfect. So the next question we have is from Caitlin, and she says, what is a typical treatment plan? Frequency, duration? What are the protocols with using other modalities during Shockwave? Can class 4 laser be administered concurrently? And do you recommend a change in NSAIDs during treatments? So it's like 10 questions.
Yes. So I'll start with what I consider the best combination of treatments, class 4 laser and Shockwave. So my Shockwave recommendation has been 6 treatments, 1 treatment a week for 6 weeks as we were getting started. And that was our kind of our baseline recommendation. I just changed the recommendation in January, where we're doing Shockwave 8 treatments. We're either doing twice a week with a few days in between for the patients that tolerate the treatment, or once a week for 8 weeks. And then for laser, we do 6 treatments 3 times a week for 2 weeks. Both of those together, when you look at the research, Shockwave done first, the laser just solidifies the treatment and brings it in deeper from there. From a cost perspective, I know everybody has different varying prices. We charge $150 per session. So 150 times the 8. And then for laser, class 4 laser will normally have 6 sessions at $125. I'll tell you this, as you present it to patients, combining it with laser, combining it with chiropractic, combining it with decompression, it greatly increases the value. And you'll see how patients get excited about it as you could explain it to them. But these are also treatments that they're feeling the difference even after the first one. So I know there were 10 questions. Did I get to all of them?
I think you covered them all. Oh, NSAIDs, yes. That was the last part.
Yeah, so I always detail that to the patient. You know, if it's a prescription medication, I will always say, you know, I didn't prescribe it. I prefer you speak to your prescribing doctor for that. And for NSAIDs, what I see is this, they don't need them. So if they're starting with them, they'll slowly back off. And they'll ask the question too, should I switch to something? Should I stop? I go, as we go through this treatment, and again, we're not talking about 6 months of treatment. They're going to feel great very quickly. So my desire with them, instead of switching, would be, when appropriate, to start backing off or coming off of them, because there won't be a need.
Perfect. And then we have one more question here. You mentioned having your elevator speech ready. What is your elevator speech?
So let me explain one of the most incredible treatments that I've seen in my 25 years in practice. It's called shockwave therapy. And shockwave therapy, acoustic wave therapy, it has a few different names. I'll get into the 1980 that it was utilized in hospitals to break up kidney stones. I'll get into the 96 Olympics in Atlanta, because I think that's a turning point from there. And then I'll get into the 9,000 studies to let them know that there is a high level, a high amount of them. And then it's really just talking about what it does. So I'll describe the 3 parts of the treatment. I'll tell them the names of each one. I'll say to them, there's no quiz at the end, but I want to be able to differentiate. And then for me, I always do everything in a written format. So I provide written recommendations that I'll review with the patient and say, this is what we're looking at. This is the time component. This is the cost. This is the payment options. Anybody that would like a copy, I am a great sharer of information. So if anybody would like to see how I create these sheets, I'll be more than happy to share with Sierra, and Sierra can share with everybody else.
Thank you. I also want to add to that, because I have 2 things that I've learned over my many conversations with people as far as quick pitches to convince people of how incredible Shockwave is. And one of them is the fact that it is the #1 requested therapy at the moment for professional athletes dealing with MSK conditions. And if someone who makes all of their money with their body functions is trusting this device and using this to feel better, then why wouldn't the average person, right?
Sure.
And the second one is that this is a very popular treatment as well in the animal health side of things, not just human health, and specifically with professional athletic equine. And you can't placebo a horse.
Sure. Very true.
So I just want to add those in there because I think they're fun.
For sure.
But thank you so much, Dr. Roistacher. That's been a lot of knowledge for our listeners. And before we start to wrap up and stuff, I would love to know, do you have any final thoughts or advice for our audience?
So I would imagine that everybody on the call either has Shockwave, is looking to upgrade it, or is looking into it for the first time. Slow down your decision process. Really seek out the best equipment, because what you're going to see from a pricing range, they're all going to fall usually within, I don't know, $5,000 or $10,000 of each other. Take the time, go for something that is the best equipment, but also has the training. And the training can't just be a video that you watch. And then the marketing component as well. So of the company that you would work with, you would want the top of the line equipment, the latest technology. You want, again, the training with the ability to not only hear, but to physically perform. And I definitely, recommend the Academy of Shockwave. That was, to me, one of the best trainings that I've been to. And I would simply say the best when it comes to Shockwave. And then again, the marketing component. A lot of us are weak on marketing. A lot of us are weak on the business side of things. And I know we hate words like sales and closing patients and all of that, but we are a business as well. And you got to have that business brain and healer brain on top of it. So for me, once I looked in what met the need of the best equipment available, the best training available, and the best marketing, let alone a family-owned business with 25 years experience, for me, it was Kinnes Medical. And that is the only one that I would purchase. And again, I did purchase StemWave prior, but once I became educated, there really was no other choice.
I love it.
Thank you.
Wise words indeed. Well, thank you for sharing your expertise with us today. And thank you to our audience for joining us. It was a really insightful discussion on kind of where the mindset should be when adding shockwave therapy to your practice. We have more information about shockwave therapy devices, implementation, and strategy. It's coming up for our Shockwave Solutions event in Atlanta, Georgia. We have two, one on March 26th and one on April 4th. They're both from 6 to 8:30 p.m. They are free to attend. It's going to be hosted by Keenis Medical. And these are going to feature like an in-depth look at the multiple types of shockwave devices and different types of technologies, as well as a hands-on demonstration portion where you kind of get to play with the systems in person and feel them and see them and get to talk to the experts one-on-one. You can register for these through the link that the QR code that is on the slide I have shared right now. We would love to have you all attend. It's going to be a lot of fun, and we hope you can join us. Awesome. Well, thank you so much. Thank you, Jeff, for joining us today and being so insightful for our guests. Thank you to our guests for attending. We will be having another webinar soon. We have one at the end of the month for animal health on the 28th, I believe. And then we're also going to have a human health one at the beginning of next month. Stay tuned for that. It'll be in your email. But thank you, everyone.
Thank you,
Awesome.
Dr. Jeff.
Thanks, guys.
Thank you, Sierra.
Thanks.